Vitamin D, often called the sunshine vitamin, is one of the most essential nutrients for our body, yet surprisingly, many people don't get enough of it. This fat-soluble vitamin is not only crucial for absorbing calcium and keeping our bones strong, but it also supports our immune system, brain function, heart health, and even mood regulation. Without adequate vitamin D, your body can suffer in ways you might not immediately notice. In today's video, we'll dive deep into 7 common signs of vitamin D deficiency, signs you should never ignore. We'll also explore why these deficiencies happen, who's most at risk, and what you can do to improve your vitamin D levels naturally.
Scene 1. Introduction. Vitamin D deficiency is surprisingly common around the world. Experts estimate that nearly 1 billion people globally may have insufficient levels of vitamin D. This can happen for many reasons. Limited sun exposure is a major factor, especially for people who live in northern climates, spend most of their time indoors, or wear clothing that covers most of their skin. Diet also plays a role. Very few foods naturally contain vitamin D, and not everyone consumes fortified foods regularly. Age is another factor. Older adults have thinner skin and produce less vitamin D from sunlight. Certain health conditions like kidney disease, liver disorders, or digestive problems that affect fat absorption can further increase the risk. Understanding these factors is important because low vitamin D can affect almost every system in your body, from bones and muscles to your brain and immune system. Scene 2. Sign 1. Fatigue and tiredness. The first sign of vitamin D deficiency is persistent fatigue. You may feel constantly tired, weak, or mentally drained, even after sleeping 7 to 9 hours. Studies have shown that vitamin D plays a role in energy production at the cellular level, which means your cells need it to function efficiently. Without enough vitamin D, your body struggles to produce energy, leaving you feeling exhausted. People with deficiency often describe this fatigue as different from ordinary tiredness. It's deep, lingering, and doesn't go away with rest. Fatigue can also affect your concentration, motivation, and productivity, making everyday tasks feel overwhelming. Increasing vitamin D through sunlight, diet, or supplements under medical guidance has been shown to improve energy levels significantly. Visuals: person struggling to wake up, yawning at work, looking drained. Scene 3. Sign 2. Bone and back pain. Vitamin D is essential for calcium absorption, which is critical for maintaining strong bones. A deficiency can lead to bone pain and lower back discomfort. You might feel achy in your hips, pelvis, ribs, or lower back, often without a clear injury. Over time, low vitamin D can contribute to conditions like osteopenia or osteoporosis, where bones become weak and brittle, increasing the risk of fractures. In children, severe deficiency can lead to rickets, which causes soft, deformed bones. Pain may also worsen with activity, making simple movements like bending, lifting, or climbing stairs uncomfortable. If you experience persistent bone or back pain, a simple blood test can check your vitamin D levels and help your doctor recommend an appropriate plan. Scene 4. Sign 3. Depression and mood changes. Vitamin D deficiency doesn't just affect your physical health, it also impacts your mental well-being. Studies show a strong connection between low vitamin D levels and depression, anxiety, irritability, and mood swings. This is because vitamin D is involved in the production of neurotransmitters like serotonin, which regulate mood and emotional health. People with low vitamin D may experience persistent sadness, loss of interest in activities, or a sense of fatigue and mental fog that affects daily life. Seasonal affective disorder, or SAD, is another example where lack of sunlight and consequently lower vitamin D can trigger depressive symptoms during the winter months. Correcting vitamin D deficiency, combined with lifestyle changes like exercise and proper sleep, often helps improve mood and cognitive function. Scene 5. Sign 4. Impaired wound healing. Narrator: if cuts, scrapes, or surgical wounds are taking longer than usual to heal, slow wound healing could be a sign of vitamin D deficiency. Vitamin D supports immune function, inflammation control, and cell regeneration, all of which are critical for proper recovery. Without adequate vitamin D, your body cannot repair tissue efficiently, leading to prolonged healing times. This can be particularly concerning for people with chronic illnesses like diabetes, where delayed wound healing is already a risk. Paying attention to how quickly minor injuries recover can provide an early clue that your vitamin D levels might be low. Scene 6, Sign 5, Hair Loss. Unexpected hair loss, especially in women, can be another warning sign of vitamin D deficiency. Hair follicles are sensitive to hormonal and nutritional changes, and vitamin D plays a crucial role in stimulating hair growth. Low levels can lead to thinning hair, excessive shedding, or even hair loss in patches. In severe cases, this condition is called alopecia areata, an autoimmune disorder linked to vitamin D deficiency. If you notice sudden or unexplained hair loss, it's worth checking your vitamin D levels along with other nutrient deficiencies, as correcting the deficiency can help restore hair growth over time. Scene 7, Sign 6, Muscle weakness or pain. Vitamin D is not only important for bones but also for muscle function. Low levels can cause muscle weakness, cramps, or generalized muscle pain. You may notice difficulty performing routine tasks such as climbing stairs, lifting groceries, or standing from a seated position. This is because vitamin D interacts with muscle fibers, helping them contract properly and maintain strength. Older adults in particular are at higher risk of falls and injuries due to vitamin D deficiency-related muscle weakness. Regular exercise combined with adequate vitamin D intake helps maintain muscle strength and coordination, reducing the risk of injury. Scene 8, Sign 7, Frequent illness or infections. If you seem to catch colds, the flu, or other infections more often than usual, low vitamin D might be to blame. Vitamin D is essential for immune system function, helping your body produce antimicrobial proteins and fight off viruses and bacteria. People with deficiency often experience more frequent respiratory infections, delayed recovery, and even increased risk of chronic illnesses. Ensuring adequate vitamin D levels strengthens your immune defenses, helping your body respond more efficiently to pathogens and maintain overall health. Scene 9, Causes and risk factors. Low vitamin D can happen to anyone, but certain factors increase your risk. Limited sun exposure. People who live in northern latitudes, work indoors, or wear full coverage clothing may not get enough sunlight. Dietary insufficiency. Few foods naturally contain vitamin D, so diets lacking fatty fish, eggs, fortified dairy, or cereals can lead to deficiency. Medical conditions, kidney, liver, or digestive disorders can impair vitamin D metabolism and absorption. Age. Older adults produce less vitamin D in the skin and may have a reduced ability to absorb it from food. Obesity. Vitamin D is fat-soluble and can get trapped in fat tissue, making it less available for the body. Scene 10. How to boost vitamin D. If you suspect a deficiency, talk to your doctor for a simple blood test. Ways to increase vitamin D include sun exposure, 10 to 30 minutes of sunlight several times a week, depending on skin type, location, and season. Diet. Incorporate vitamin D-rich foods like salmon, tuna, mackerel, eggs, and fortified products like milk, yogurt, and cereals. Supplements. Under medical guidance, vitamin D supplements can safely correct deficiencies. Lifestyle. Regular exercise, a balanced diet, and adequate sleep support overall health and help your body utilize vitamin D effectively.
Now that you know the 7 signs of vitamin D deficiency, it's time to take action. Pay attention to your body, spend some time in the sunlight, eat vitamin D-rich foods, and consult your doctor if you suspect a deficiency. Remember, your health is in your hands. Small changes today can make a big difference tomorrow. Thank you for watching. Don't forget to like, share, and subscribe for more health tips and wellness advice. Stay healthy, stay happy, and let the sun shine in.